October is Breast Cancer Awareness Month, and there are all kinds of resources for patients and their families.
Dr. Blaes is an oncologist at the University of Minnesota. Thanks for being with us,
Thank you for having me.
So you are looking into recovery and the best ways that people who have kind of made it through treatment can prevent recurrence, right?
Correct. We do a lot of work for survivors, and many of them ask me, how do I stay well after going through treatment?
And your research looked at kind of maybe something beyond a pill that could make a difference for folks.
Yeah, many patients when they go through cancer treatment will say they're fearful of recurrence. Many will have some anxiety about that, sure, or suffer from depression after their treatment. And many will want to know, what can I do for this? So we conducted a study looking at a technique called mindfulness-based cancer recovery based on the theories behind Dr. Linda Carlson, where women went through a series of classes with meditation, relaxation, yoga, and saw actually significant reductions in depression, anxiety, fatigue, and improvements in sleep.
So for people at home who are breast cancer survivors or may know someone who is, what would you recommend in terms of what they should do? Should they do yoga? Should they practice meditation?
You know, I think it's one thing that can certainly be done to help them in the recovery process. As you mentioned, many patients will tell me, I don't want to take one more pill. I just took a whole bunch of pills to go through my treatment. And this is one thing that they can do to help. At the University of Minnesota, our Center for Spirituality and Healing, we conduct these classes regularly during the fall and the summer and spring. I know there are a number of places in the community that also offer courses like this if they're uncomfortable doing that on their own.
You've also been telling us that physical exercise can be an incredible healer for people, which is kind of scary, I think, when you're going through breast cancer treatment and, you know, physically you worry about moving your body and just the strain that it would have on your body.
Yeah, exercise is really important. We know during treatment, so if you're with somebody who's going through chemotherapy or radiation right now, actually exercise can help with fatigue. It's probably the thing the most, more than any other types of medications or other treatments.
It doesn't have to be strenuous.
No, it doesn't have to be strenuous. And there are, after treatment, we know women who exercise regularly. So in some of the studies, 150 minutes per week, which is roughly about a half an hour most days of the week. And in these studies, that was moderate intensity. So moderate intensity walking, for example, they actually had almost 30% less recurrence of their breast cancer.
Wow.
So I always tell patients, get out there moving, bring someone with you, and if you can't do 30 minutes when you're first done with your treatment, you know, do intervals of 5 minutes and do that a couple times a day, and gradually that will get better.
Very good. Nice to have that hope for different ways people can move forward. It's not all about the medical treatment, it's about the aftercare too.
We partner a lot with our community partnerships.
Really good. Dr. Blaes from the University of Minnesota, thanks for coming in.
Thank you. Thanks for having me.